Are you a seven-figure practice owner that wants to do more without burning out? Join us for the Seven-Figure Practice Retreat, a luxury mastermind where high-level practice owners step away from the day-to-day to build systems, strategy, and freedom in the Dominican Republic. This February, spots are limited, so apply now, and our sponsors are covering 95% of the cost over at practiceofthepractice.com/7. Again, that's practiceofthepractice.com/7. This is the Practice of the Practice podcast with Joe Sanak, session number 1266. Welcome to the Practice of the Practice podcast. I am Joe Sanak, your host, where we help you build a thriving private practice you absolutely love. We are so excited to have you here today, hanging out with us. Now, back in May of 2025, we put on the Group Practice Conference. And at this conference, I had this dream of putting on a conference that was unlike any other. I wanted the feeling to be like connections, that people had time to meet each other. I always hated conferences where the parts that I love the most, probably getting dinner with new people or having drinks at the end of the evening, that part was so small in the calendar. And I spent most of my time just running between breakout sessions and keynotes and all of that. And the other side of it was oftentimes it felt like I would be in a session and it'd be a 90-minute session. And I really only got about 10 to 20 minutes worth of content. There's a lot of fluff in there. It just felt like get to the point. And so for what we decided to do at the Group Practice Conference was we decided that we would have 20-minute sessions on the main stage, all of our keynotes, 20 minutes, and that we would have ample time for breakout sessions, and to have time to dig in, to talk about group practice, to get to know people, and to encourage people that if they're having a great conversation, keep that going. You don't have to come back in. Continue those conversations going. And so we found that the folks that came to the Group Practice Conference in May had such a great time. They felt emotionally connected to other group practice owners. And it was just such a great event that we've tripled the size for May of 2026. We're going to be over at Northwestern Michigan College, right on their campus. And we are partnering with both Headway and the Student Life Department to put this on. And our main stage is going to be where the actual TED Talks of Traverse City take place. And then all of our discussions and our kind of digging deeper sessions are going to be throughout an art gallery. It's going to be just such a fun, unique event that we're super excited about. And lots of you weren't able to make the Group Practice Conference in 2025. And so we want to give you just a little glimpse into that. So we're going to be doing a series every week for a while throughout the end of the year where those 20-minute main stage sessions, we're going to be playing those for you. We want you to be able to learn from all of our speakers that we had, and we want you to get excited for the Group Practice Conference in May 2026. So we want you to get excited for this over at grouppracticeconference.com. That's where you can be on the waiting list so that when tickets go live on Black Friday through Cyber Monday, you can grab your ticket. We want you to get those discounts that we have. We want you to get any of those kind of lowest priced tickets. We know they're going to sell out fast. All of our sponsors have committed to sending emails to their list. And, Headway alone, who is our co-host of this, along with the Student Life Department over at NMC, has 60,000 people on their email list that are part of Headway. So we expect, the 300 or so tickets that we're offering to go quickly. So if this is something that you're interested in coming to Traverse City, we want to make sure you're on that wait list and ready to go on Black Friday so that you can get your ticket. We know they're going to go quickly. So head on over to grouppracticeconference.com and you can watch all the different things going on there and get on the wait list so that when that goes live, you get first access. So let's dive into this episode with some of our speakers from the Group Practice Conference in May 2025.
Good afternoon, everyone. How are we doing?
Hello.
We're good? Yeah? A little sleepy, that afternoon dip? Okay, well, we'll get you back together. Thank you for joining us. We're really excited to keep conversations going. We've already had such a really awesome morning talking to everyone, and getting to know our friend Jane. My name is Dr. Emma Furze. I'm a licensed naturopathic physician. I'm located just outside of Vancouver, British Columbia, Canada. So that's where my accent's from. That's also where Jane was founded and born. And that's where our headquarters are now, although we have staff working all over the world.
Yeah, and my name is Allie Joy. I'm a licensed professional counselor and board certified art therapist based in Connecticut. And we were really excited for this opportunity to come talk as Jane ambassadors, but as providers, because I feel like myself as a provider, when I hear about something, it's great to hear from the team, but to hear from someone who uses it every day pretty much feels really great. So we were excited to come talk to you all. Before we get started, we would love to know, is anyone here a Jane user? Ooh, we have a Jane user. Okay. If you don't use Jane, have you heard of Jane before? Okay, some people. Now, there's no judgment, but is there anyone here wondering who the heck Jane is? Perfect. Well, we're excited to share about why we talk about her like she's our best friend, because she is pretty much.
So just a quick overview of some of the things we're going to talk about today. This is not totally inclusive of everything we want to talk about. So we have lots of time tomorrow to answer more questions and get to know you and some of the things you're looking for. So I think this is just sort of the basics. Jane's mission is to help the helpers. We keep it super simple, but that's the goal. It was founded to help multidisciplinary clinics moving into, solo practice, group practice, all sorts of things like that. So we're one of the few allies to allied health practitioners in the healthcare space. We want what's best for them, for their small business as they grow to large businesses, and ultimately providing the best care for our communities.
And Jane's vision is very similar, always wanting happier helpers, which as the helpers feels fantastic, of course. And so Jane's vision is to create a thriving community of healthcare professionals who are succeeding in their business, providing engaging care to their patients. And in that, Jane is a delightful, powerful, and integral member of those teams. And we heard recently someone say that they want Jane to be Employee of the Month every month. And we both, I think, would say Jane's our Employee of the Month for sure.
So we were actually, Allie and I were just in Palm Springs this past weekend at a Jane event, and we were talking about a lot of features. And features are all great, but features only are useful if they add benefit, right? So we can have this list of things that it does, but what actually helps your practice grow. So these are sort of three main pillars that we wanted to talk about when we get into our favorite features soon. The first thing we want features in Jane to do is simplify daily workflows. So we want things to be easy, help you make processes, streamline things, and ultimately make it easier for you as practice owners, but also your admin and your practitioners on your staff. Reducing admin time. So for a lot of people, we might not even nowadays maybe have an admin person at the front desk. So we want to reduce either that time, or if we do have someone there, ultimately not having them, have an hour-long checklist to close out or something like that. All of this really just gives you back time. And by having more time, we can see more clients, we can treat more patients, and we can boost their engagement, have them coming back and, help foster those relationships.
So they only gave us 20 minutes to talk total. So we had to keep it brief as we can. So a couple of the things that I really love talking about as a provider, my favorite things with Jane. The first one being that for me, before Jane, I had so many different tabs open at all times. My payment processor was in one tab. I had scheduling. I had communications. I felt like I was always in multiple places and none of them talked to each other. And so with Jane, pretty much everything I need is in that one platform, which I feel like simplifies my to-do list. I'm a little forgetful sometimes, so I feel like having it all be together really helps me streamline my own work that I do, and they all work together instead of being completely separate entities. So for me, that has been a huge switch with Jane, is just having everything be so integrated, and that's been really wonderful for my own practice. Another thing that I love is the supervision features in Jane. I'm an art therapist, and so I'm usually a bonus supervisor, which I'm very lucky, but also in supervising and having associate clinicians, interns, and different things like that. It's amazing that Jane has features to really customize your needs for your practice if you have people working either as associates, interns, and things like that. And it's customizable, which for me is kind of across the board with Jane. So with supervision features, you can really customize the access that people have to different charts and parts of charts. There's also features where you can have it be automated for like signatures if you have to sign off on notes. And there's also features where if you have some notes that need to be signed and some don't, you can change a permission so that you're not getting a million notifications for things that you don't have to sign, which again is really trying to really streamline and optimize our time. And this is a feature that's grown a lot with Jane, and I'm excited to see where it goes because, again, I feel like Jane really listens to our needs as providers. It does take time because, they have to develop it and code it and all the things I don't understand. But this is one that I really have seen grow so much with Jane, and that just feels so great to have the customization for all of those things. And then I would say this is what I talk about the most, is how easy it was to switch to Jane for myself in my practice. I feel like I stayed with my previous EHR. I didn't love it. I didn't think you could love an EHR until I met Jane. And I felt stuck because I thought, how am I going to have the time to transfer 7 years of client data, charts, all the things? I was like envisioning myself like on my nights and weekends, like typing in all of my clients and everything. I was like, I can't do that. I don't have time for that. I can't switch. And I felt really stuck. And I kind of felt like boxed into options I didn't need, things I wasn't using. And then thankfully, someone told me about Jane, and I learned that they have an entire team dedicated to imports, which feels very unique and special. They told me exactly how to download my data from my previous EHR, told me how to upload it, and they did it. It was amazing. I couldn't believe it. And that's why this is something I talk about all the time, is because as business owners, I could have something to do for the rest of my life. There will always be something on our to-do list. We have endless tasks. So for me, this was really important. And something that was really important for me as well was on the client end. I wanted it to be simple for them too. I was really concerned about that. I didn't want it to be really confusing, complicated, and things like that. And at least the feedback I received from my clients is they just kind of had to go in and verify things. And then it was a really simple switch. So that was important to me too. So again, I could talk about these things forever, but we'll pass it over to Emma and maybe hear what some of her favorite features are.
Whether you're growing your team or running an established practice, Headway makes the business side easier with faster credentialing, higher per-session rates, and bi-weekly payments your team can count on. They work with therapy, psychiatric, and hybrid group practices. There are no subscription fees, just the support you need to run your practice with ease. Run your best group practice with Headway, trusted by thousands of group practice leaders to simplify insurance admin and reach more people through in-network care. Curious how Headway can work for you? Head to join.headway.co/Joe. That's join.headway.co/Joe to learn more.
Okay, perfect. So like Allie, it was really hard to narrow down the list, and that's not a typo. We spell things with a U in Canada. So the first thing that I love, especially as a solo provider, is Jane Payments. So it's our integrated payment system all through Jane. For me, I do also a lot of telehealth. So one of the best things about this is that we can store credit cards on file safely and securely for you and your clients. So it feels really good peace of mind that way. After a session, you can run a copay. You can run the whole thing if you're cash. I don't know how things work down here. It's very different. But the idea is that you don't have to talk to anyone and you can just email them a receipt. If you do see folks in your clinics or, face to face, and there is a terminal option if you want to process things that way. Jane Payments has really competitive processing rates, which I think everyone can appreciate as a business owner. And you get paid every 2 business days. So I also love, every day or every 2 days kind of getting that payout. It's just nice and it keeps things going really smoothly. Jane Payments literally runs my practice. I have kind of segueing into online booking, but I have a policy where I require every new patient of mine to put a credit card on file. That's just in order to book the appointment. You got to do it. Sorry if you don't. I don't want to see you. But if you do that, that allows you, that for me in my practice, and I think we've heard this from a lot of our accounts, is that it really decreases the number of late cancellations and no-shows. When someone has a card on file, which I think most people are used to nowadays, right? You book a hotel, you reserve a car, whatever, you got to put something down. So people say oh, I wasn't going to show up. Oh, but Allie has my card on file. She's going to run it anyways. I guess I should go to my session. So it just helps people show up. It decreases those cancellations, those no-shows, to help your schedule feel. Nobody really feels good about charging those fees anyways. So if we can just decrease the need to do that in the first place, helps out a lot. Online booking. Who here uses online booking? Okay. Who doesn't? Okay. So there's interesting stats that most appointments are actually booked after 7 p.m. So if you're not using online booking, this might be food for thought. You know, a lot of people are sitting on their couch. They've put the kids to bed. It's silent. What do I need to do? Oh, I need to book that therapy appointment. Well, your admin staff isn't there to answer the phone at 9 o'clock. So what do? I can book online. Gives them that dopamine hit. They feel good about their appointment being booked. So online booking allows people to do that from the comfort of their home, any time of the day. I'm a millennial, so I would rather never speak to someone on the phone. I'm really not likely to make an appointment if I have to call. I will actually find somewhere else to go that has online booking. I know. But a lot of us are like that. We don't want to have, or I don't have time to pick up the phone. Or if I pick up the phone and I call and you don't answer, I'm probably not calling back. I might leave a voicemail. I probably won't actually. So online booking really helps. I mean, for my practice, 85% of my appointments are booked online. It's a pretty big number. So helps with retention, we can send those return visit reminders, book your next session, do it in the moment when they leave. But online booking is a big game changer. Jane has customizable settings to, cluster things together, to stagger things. I know therapists, right? You need a break after. Someone's just been sobbing for an hour.
Who takes it though?
I need 10 minutes. You can add that in. It's a buffer. Easy. Jane will do that for you. Okay, so note-taking. I hate charting. I really do. So note-taking, really easy in Jane. We saw customized templates earlier today. We're going to see them again. Customized templates are how they float my boat. They keep me going. Makes things a little bit easier. Obviously, AI charting is coming as well, which we love. But at least with Jane's note-taking features, we can have, your customizable things, your checkboxes, your sliding scales, your ranges, your drop-downs, really nice things. I sometimes draw pictures too. So that helps as well, having that little note, or, if you do a activity with a client and then you can feel free to draw about it or whatever. So lots of great features that way. Again, like this list is not exhaustive, but kind of gives a summary of how some of those little things can ultimately really give you back time.
And of course, we have to talk about the money. So with pricing for Jane, I think one of the things I've loved the most is that, again, going back to that customization, because I felt like with previous or different options, you're just kind of being put into a box. And Jane is really set up to grow with you and grow with your practice. So Jane has options if you're like for part-time solo providers, but also for part-time providers in a group practice. So you're not paying the same rate to have a part-time clinician versus a full-time clinician, which I think is so important for that, again, those options to really, again, grow with you, be with you where you're at, and kind of scale from there. There's also lots of customizable add-ons for like insurance billing and different things like that. So again, I feel like as a provider, especially, I appreciate that because there's been different phases of growth in my business where maybe I'm scaling up one part, kind of toning down in another, and having like that support of not just being locked into something or not feeling forced to use features I don't need is really important. So that's something, again, that at least stands out to me for pricing.
So Jane is listening to the community and building based off of what people want and need. So a couple of things that are in the works or in beta right now. First thing is AI Scribe. Really exciting. Obviously going to help save more time, give you that back. Secure messaging. Right now, the beta is only open in Canada and I'm using it and I'm absolutely loving it. It's so easy to just, send a patient a message about, a quick reschedule or something quick that way, and then just avoid emails and other forms of communication. It's all directly in one place. Like Allie said, having that, all in one spot is just so important for streamlining things. And then currently, we do a one-way calendar sync, so you can put your Jane shifts or schedules or whatever into Google, iCal, things like that. But our development team, bless them, they work so hard. They are working on populating your Google Calendar, which most people use for like personal stuff, into Jane to automatically block things off. So that'll be a really exciting thing coming soon.
Yeah. So again, we could talk about this forever, but we would love to be able to chat with you. If anyone has questions, we're going to be here for the whole conference. So we're happy to answer questions. We also have our laptops. So we have demo clinics where if you're looking to see what Jane looks like, if you have certain questions, things you want to see. We also, for Jane with pricing, there is a calculator. So you can try to estimate based on your clinic size. So you can do it in that way. And then also, of course, we are providers. Emma actually used to work for Jane as well. So we know a lot. But you're also welcome to book a demo with the Jane team as well. So that's what this slide is with the QR code. And they're always love to talk to providers. Again, as a provider, that is so important to me. The times that I can speak to someone and they help me and then they follow up. It's amazing. It's the best. So you're also welcome to, of course, book a demo or come chat with us while we're here.
And just for everyone today and for these 2 days, we're going to be giving a 1-month grace period. So there's the code up there. We can also write it down for you when you come see us. We find 1 month is kind of a sweet spot for people to open an account, play around with it, look at the import process, maybe schedule your import, start to export your previous data, and also really connect with the support team at Jane. Allie says they're the best group of friendly Canadians. So really always there to help you and really support that transition. Account setup calls are available, all things like that to give you that first month to really get things going. And yeah, feel good about your new account.
So that is, again, our crammed in. I think we have a teeny bit of time if anyone has a question.
You got 3 minutes.
3 minutes. Does anyone have any questions for us?
Oh. Yeah, so she asked if you're able to use Google Tag Manager. I don't know what Tag Manager is, but I can tell you that you can see how things were booked. So there is a new thing called Reserve with Google. So you can actually have that book online button if someone does Google you, and then appointments will have that tag on it as well. But I don't think like full Tag Manager. But you can have people fill out their referral source or things like that. But are you thinking about like SEO?
Yeah, we can also, because we are providers, so any of these questions we might not have the answers to, we have access, we can ask support, we have our computers and things, so please follow up with us if there's anything. So we'll follow up on that.
We'll get you an answer.
Okay, so again, if you have more questions, please, we'll be here. Please come chat with us. We'd love to hear from you all.
Well, thank you so much for hanging out with us and listening to our speakers from the Group Practice Conference 2025. We are so excited to have you join us there. Make sure you put on your calendars Black Friday. That's when tickets open up. We want to make sure that you grab that ticket right away. We are so excited to be hosting this here in Traverse City. We could not do this show without our amazing sponsors. And today, Headway is our sponsor. If you are looking for help running your practice and want the best group practice you can have, you're going to want to sign up with Headway. They are trusted by thousands of group practice leaders to simplify their insurance admin and reach more people through in-network care. If you're curious about how Headway can help work for you, head on over to join.headway.co/Joe. That's join.headway.co/Joe. to learn more. Thank you for letting me into your ears and into your brain. Have a great day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music, and this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.